We turn now to the topic of sleep. It is so critical to one's health, and unfortunately, most of us don't get enough. And now there is a new study that links night owls to heart health concerns. So, according to new research published by the Journal of the American Heart Association, middle-aged and older adults, especially women who were more active in the evenings, had poorer cardiovascular health compared to their peers who were more active during the day. Researchers reviewed health data from more than 300,000 adults to assess how a person's natural preference for sleep-wake timing impacted their cardiovascular health. Joining us now is Dr. Leigh Vinocur, who is a board-certified physician and the author of Never Let Them See You Sweat: How Science Can Help Us Harness Stress for Success. And Dr. Vinocur, we appreciate you joining us here on Live Now from Fox.
Thank you for having me, Stephanie.
So before we delve into the study itself, can you define from a medical standpoint what exactly is a night owl? How can people identify as one?
Well, it's an evening chronotype, as they call it. And basically, it's people that prefer, they stay up late, they sleep in, and they're just more active in the evening hours. They're more comfortable. But what was interesting with this study that you spoke about, it did look at about 300,000 people, and there was a 16% increase in cardiovascular disease. And they looked at these parameters that the American Heart Association looks at for heart health. So besides maybe getting less sleep, they tended to eat more poorly, eat later at night. So their diet wasn't great. Their weight might have been up because we know two studies from people that are night shift people, they have higher weights, higher stress, and they too have poorer cardiovascular health. And so they weren't maybe eating properly, they weren't exercising enough, and basically they spend more time awake in the evening. And humans are not really meant to be nocturnal, and our whole world is like a 9 to 5 kind of a day usually, unless you're a shift worker, of course, which has its own set of problems. But
so for people who try to go to bed earlier and they're tossing and turning, is it less the hours and more of perhaps the poor habits that might be attributed to that time of the day? Or is it actually the time itself when folks end up going to bed that leads to poorer cardiovascular health?
well, that's a great question, Stephanie. And truthfully, it's like a combination of both, really. But the other thing is it's this circadian misalignment. And what happens then is you have increased cortisol levels, increased stress. And I talk about it in my book. You're in this constant low level of stress, which is that fight or flight response. And that's very hard on your body. It can lead to inflammation, insulin resistance, immune problems that can lead to high blood pressure and poor cardiovascular health and parameters. So it's a combination of everything. It's going to bed late and then maybe not getting enough hours of sleep too, because, say you have a 9 to 5 job and you're going to sleep at 2 and 3 in the morning, you're not going to get enough hours.
I also wanted to ask you this because the study noticed that this affects women particularly hard. Why is that?
Stress is very tough on women. So there's hormonal rhythms that don't line up when our circadian rhythms are off. But also, we just do too much. My whole book was to tell women to give themselves a break and not be so hard on themselves, because we have caregiving responsibilities. We have most of the responsibilities in the home, and we're working too. So, we're just doing too much. And that's part of the problem anyway. So women's stress levels in general are usually higher than men's stress levels anyway, because of all this added burden of other things besides our job.
All right, so we're getting even more stressed now that we hear that. But I wanted to ask you this. If people get 7 to 8 hours of sleep, even if they go to bed a little bit later, does that help offset some of these impacts?
Yes. So the quantity of sleep is kind of just as important. So if you get a good 7 hours of sleep, say you're going to bed at 1 in the morning, but maybe you don't have to be in the office or to work until 10, and you get some good sleep and you eat healthy during the day, and you try and get a little exercise too. Say you go in later and you exercise in the morning. Those things can counter it. It's really those people that are really night owls where they're going to sleep very late in the day. They're not getting enough sleep. And then their high levels of cortisol because of lack of sleep. It's like a vicious cycle with cortisol, lack of sleep, and everything like that. So you can work on some of these things like eating healthy, exercising, trying to make sure you get enough quantity of sleep. So.
It may not be possible for everyone, but you were talking about the circadian rhythms. Ideally, from the health and medical standpoint, when should people try and wind down and go to bed for the biggest health benefit?
Right. So we talk about sleep hygiene too. So getting rid of the blue light that we see all the time at night, whether it's a television screen or whether it is, a computer or an iPad. So trying to turn that off an hour or two before you go to sleep, even if it's at midnight, just give yourself an hour where you are not looking at that blue light. That will help reset your circadian rhythms. And then, of course, also, very dark rooms, cool temperature, which isn't that hard nowadays. It's pretty cold out everywhere. But those things are really important to really get good quality sleep. So focusing on your sleep hygiene and keeping that schedule is good. Even on the weekends, people tend to stay up later, do more. But if you can keep a schedule on the weekend, that'll help reset your circadian rhythm too.
All right, so we have our marching orders for tonight. We'll see how successful it is. But Dr. Leigh Vinocur, we appreciate you, as always, taking the time to join us here on Live Now from Fox.
Thank you. It's an honor as always.